Hello, my name is Robert Larigo. I'm the Director of Endoscopy at the Center for Digestive and Liver Health at Santa Clara Valley Medical Center. On behalf of our staff, our providers, and the enterprise, thank you for allowing us to care for you and your loved ones. You are scheduled to undergo a colonoscopy. During this procedure, you will be given medications intravenously to make you sleepy and comfortable. Once you are comfortable, a colonoscope, which is a thin and flexible tube with a light and a camera at the end of it as thick as your finger, will be inserted in your rectum to examine your colon. Any abnormal tissue that we may see or small growths called polyps may be safely removed with the colonoscope. The procedure typically lasts about 30 to 45 minutes. The key to a high-quality colonoscopy is a high-quality bowel preparation done with strong laxatives. The colon is typically filled with stool that would otherwise prevent us from seeing the walls of the colon and diagnosing disease with the colonoscope. If the colon is still filled with stool during the procedure, it's possible the procedure may have to be stopped early and repeated on another day. A high-quality colonoscopy begins with a high-quality bowel preparation, and this video is intended to guide you through that process.
Information about PrEP meds. How to store your medications. Preparing meds. When, how to mix the medications. The side effects of a bowel prep. You will have lots of diarrhea from the bowel prep. This will start anywhere between a few minutes to 3 hours after you start the prep. You will spend a lot of time on the toilet once you start taking the prep. So plan to be home and plan to be near a toilet. Most people have bloating and abdominal discomfort, and many report feeling cold. Many people have nausea. This is normal. Do not be alarmed if you feel these symptoms. Some people do not like the taste or smell of the medication. However, it is still important that you drink all the prep as directed. Rarely, some people throw up while taking the prep. The following is an example of a clear liquid diet. Tea, water, black coffee, apple juice, Gatorade, 7-Up or Sprite soda, Jell-O, and chicken or beef broth, low sodium, fat-free. Items that are not allowed are milk, non-dairy creamer, no orange juice, no fruits, no toppings, no sugar, no fruit pulps, no chewing gum. Avoid any alcohol, any items in red or purple coloring. What to expect during the dieting. Nausea and diarrhea. SUPREP colonoscopy 1-day clear liquid diet for procedure in the morning. The following is an example of a SUPREP 1-day clear liquid diet for a morning colonoscopy procedure. 1 day before your procedure, have a clear liquid diet the whole day, breakfast, lunch, dinner, snacks until midnight. No solid food until after the procedure. Drink 6 to 8 glasses of water or clear liquids during the day to avoid dehydration. 8 a.m. in the morning, take 2 of the Dulcolax or Bisagadil tablets. Continue to drink plenty of clear liquids throughout this time. 4 p.m. Take 2 of the Dulcolax tablets. SUPREP first dose. 7 p.m. and 8 p.m. Pour 1 6-ounce bottle of SUPREP liquid into the mixing container. 2. Add cool drinking water to the 16-ounce line on the container and mix. Note, dilute the solution concentrate as directed prior to use. 3. Drink all the liquid in the container. 4. You must drink 2 more 16-ounce containers of water over the next 1 hour. 8 p.m. Take 2 of the simethicone tablets. The morning of the procedure. SUPREP second dose, 4 a.m. to 5 a.m. 1. SUPREP preparation instructions. Pour 1 6-ounce bottle of SUPREP liquid into the mixing container. 2. Add cool drinking water to the 16-ounce line on the container and mix. Note: dilute the solution, concentrate as directed prior to use. 3. Drink all the liquid in the container. 4. You must drink 2 more 16-ounce containers of water over the next 1 hour. 5 a.m. Take 2 of the simethicone tablets. Nothing more to eat or drink now until after the procedure. Please take your medications as usual, especially your blood pressure medication as approved by your GI doctor, with small sips of water. If you are diabetic, for people with diabetes, any procedure that causes you to miss a meal or change your usual meal plan will require special planning to safely manage your blood glucose. If you are taking medication for diabetes, expect a call from a GI nurse to go over the medications. Please note, you must drink the entire gallon of GoLytely solution for an accurate examination. If your colon is not well cleaned out, the exam may have to be rescheduled. Your last stool should be a clear or yellow liquid. If the stool is still formed or preparation is not going as expected, please call 408-885-7658. Please continue taking aspirin unless directed otherwise by your physician. If you are taking blood pressure medications, please continue to take them at least 2 hours prior on the day of the procedure with a small sip of water. Do not take any iron-containing medication such as ferrous sulfate for 1 week before the procedure. PrEP hasn't started working yet. Different people respond differently to the bowel prep. Some people start having diarrhea within minutes of taking the PrEP, while others have no response for an hour or more. If you have waited more than 3 hours without a response, then it may not be working well. Be sure you are drinking enough fluid as instructed above. If that doesn't work, take a second part of the PrEP and continue to drink fluids. It should work eventually. If not, then call us. Remember, you cannot drive after the procedure. The medication may cause you various levels of impaired judgment, short-term memory loss, and drowsiness for the remainder of the day. Therefore, a responsible adult must come to the GI endoscopy suite to pick you up and accompany you after the procedure. Tips for a successful colonoscopy bowel prep. Plan ahead, clear your schedule, and arrange for privacy. Follow the exact bowel prep instructions. Keep a variety of clear liquids on hand. Stay near a bathroom. Use baby wipes and soft toilet paper to reduce irritation. Chill your medication in the fridge beforehand. Thank you for watching. If you have any questions, please call the clinic at 408-793-2550 or the nurse line at 408-885-7658.